Hi friends, I'm here again with another video. Today we are going to deal with the OET reading part B. How we can tackle this type of reading. For part B, first we have to read the question, then the answer options, then the text. Here I am following the strategy which was taught by Father Salim from eduskill International Academy, which helped me to improve my reading skill. So let's see how we can do it. First of all, what we have to do, understand the general idea of the topic. Then we have to understand what is the topic. Is it document? There are different types of it may be an email, it may be a memo, it can be an advice for the nurses or the policy procedures like that. So we should differentiate it. What is that? Then we have to look for the keywords from the question itself. There are some synonyms they can use also. So the way we will understand and make a summary of will get the general idea of the text will give you the right answer. So let's see how we can tackle this paragraph. Okay. So what does this article tell us about the discharge medication dispensing process? So option A, all prescriptions have to be at the hospital pharmacy an hour before the patient is due to go home. Then the B option is the prescription goes to the hospital pharmacy after being written up by the medical officer. Then option C, the medical officer must let the hospital pharmacy know if there are any amendments or corrections to be made. So without reading the text, can you guess which will be the answer? Option A, all prescription have to be at the hospital pharmacy an hour before the patient is due to go home. It should be, it's an order like that, is a must they are telling. You will see in the text. The prescription goes to the hospital pharmacy after being written up by the medical officer. There is a logic because it should be written by the medical officer, then only it will go. That is the practice what we are observing in our unit. Then the medical officer must let the hospital pharmacy know if there are any amendments or corrections to be made. So they can make and they can see in the system, but it's not their responsibility to inform the pharmacist, isn't it? So let's read the paragraph, text and see. Discharge medications. So we have to see the heading first. Then the discharge prescription must be completed by the medical officer with reference to the current medication chart. The discharge medication section of the electronic discharge summary should be used for this process, with the prescription being printed and then forwarded to the hospital pharmacy. The steps they are explaining. The EDS discharge prescription or the discharge medication form must be forwarded to the pharmacy at least 1 hour prior or 3 hours for complicated discharges. So there are some options there to the patient being discharged from hospital. If amendments or corrections are made after sending the EDS discharge prescription to pharmacy, it is the responsibility of the medical officer who completed the EDS discharge prescription to make the amendments to the discharge summary within the EDS as soon as possible to ensure the GP receives accurate information regarding their patient's medication on discharge. So what do you think? Which will be the answer? Option A, you can see there are some options. If it is a complicated case, at least 3 hours prior. So option is not the one. Then the B, the prescription goes to the hospital pharmacy after being written up by the medical officer. It's mentioned that discharge prescription must be completed by the medical officer with reference to the current medication chart. Then they are telling it should be made in this system, then you have to. Then the third option, the medical officer must let the hospital pharmacy know if there are any amendments or corrections to be made. but it is not the way they have explained in the text. They are mentioning that if amendments or corrections are made after sending the EDS discharge prescription to pharmacy, it is the responsibility of the medical officer who completed the EDS discharge prescription to make the amendments to the discharge summary within the EDS as soon as possible. So they are just mentioning it is the responsibility of the doctor who made the prescription to make any amendments or correction. They don't mention he has the responsibility to inform the pharmacy department. So it is well clear from the answer. B option is the right answer. Let's look on another question. What does this information on injection technique tells us about the lifted skin fold techniques? So they are talking about a way of injecting the medication skin. A. The lifted skin fold technique allows for a suitable needle choice to be made. The lifted skin fold technique ensures medication to be administered into the muscle layer. The lifted skin fold techniques involves releasing the skin quickly to reduce the risk of bruising. Just try to guess which will be the answer without reading the text. So let's read the text. As the amount of subcutaneous fat varies between patients, individual patient assessment is vital before carrying out the procedure. So what we understood is that the amount of the subcutaneous fat varies in each person. It is important to avoid inadvertently injecting the drug into muscle, as intramuscular injection can affect drug absorption. For example, inadvertent administration of insulin into the muscle can lead to accelerated insulin absorption and lead to hypoglycemia. So what you understand? Accidental injection of this insulin or any other medication into the muscle can speed up the absorption. So what we have to do, be careful when we are administering medication. For example, they are giving an example of insulin. If we administer it into the muscle, it will speed up the absorption and it can lead to the side effect of hypoglycemia. So they are explaining about it, a injection technique what we can use to avoid this risk. So a lifted skin fold technique. Pinching or bunching the skin can be used to administer subcutaneous layer away from the underlying muscle. This method reduces the risk of inadvertent intramuscular injection when undertaken correctly. However, releasing the skin too quickly before the injection is completed or lifting it incorrectly can increase that risk. Needles need to be long enough to inject the drug into the subcutaneous tissue. They come in lengths of 5 cm, 6 cm and 8 cm. It is suggested the required needle length can be estimated by pinching the skin using the lifted skin fold technique and selecting a needle that is 1.5 times the width of the skin fold. So here it is mentioned how to select the proper size of a needle. So we can go back to the question and options. What does this information on injection technique tell us about the lifted skin fold technique? Option A. The lifted skin fold technique allows for a suitable needle choice to be made. Then B. The lifted skin fold technique ensures medication to be administered into the muscle layer. That's wrong. They are telling it can avoid the accidental administration of medication to the muscle layer. Then C. The lifted skin fold technique involves releasing the skin quickly to reduce the risk of bruising. It does not mention about this one, but they were telling, however, releasing the skin too quickly before the injection is completed or lifting it incorrectly can increase that risk. What risk? Accidental injection of medication to the muscle layer. So what is the right answer here? Option A. The lifted skin fold technique allows for a suitable suitable needle choice to be made, because they are telling right size should be chosen. Okay. So what do you think is the best strategy to solve this OET reading part B? We must appreciate the effort of Father Salim Joseph is taking to make it in a simple way to understand for each and every student. So I really appreciate his effort. You can watch that eduskill International Academy. That there are a lot of videos regarding the all modules. So it will help you to crack the OET in first attempt. I am quite sure, because it helped me a lot to tackle this OET listening and reading part B and C. I hope it will help you also. Thank you very much for supporting my channel. Keep watching on. Thank you.